All right, welcome back here on Live Impact News on the WCNC Charlotte app. We have some special guests here in studio right now. So our next guests are a part of an organization dedicated to expanding healthcare access and promoting lasting wellness in communities. I mean, they offer a range of services to address diverse health needs and promote overall well-being. And I said a range of services that includes primary care services. I know some folks out there need a primary care doctor, so listen up. Also telehealth services. Those are just two of the many services they offer. And this Saturday, they're holding their second annual Legacy Lap. Welcome here in studio, Kendall Gwynn and Jermaine Brooks with the Rapha Way Foundation. Did I say it right? I've been practicing on the name. Did I say it right? Rapha Way? Okay.
You have it right. Yep.
Oh, man, thank you guys for joining us.
Thank you for having us.
Thank you.
For those who are unfamiliar, what is the Rapha Way? I know I kind of gave a quick sort of description. What is the Rapha Way Foundation?
So Rapha Way we established in 2024. It's a nonprofit organization. We are providing access to healthcare. That was our mission when we started this up. We wanted to get as many individuals being able to learn more about their health, and also just feeding the gaps that are here in the healthcare arena. So that's kind of what our mission was, and also just providing that referral piece for individuals, even if they need to see any specialty care needs, then those are the things that we were here to address.
2 years. I was about to say only been an organization for a year now, but we're in 2026. Sometimes I'm in 2025. Sometimes I'm in 2025. What have you learned in these 2 years of working with Rapha Way?
I would say, having healthcare is a privilege, and you never really realize it until you're in a space with people who don't have access to the same thing that you might have access to. And so just being able to bridge that gap, or be a piece of bridging that gap, has definitely caused me to look and to kind of go back on my growing up and the privilege that I have had to be able to, easily go see a PCP, be able to pay that copay. Some people can't do that. Even transportation, little things like transportation, getting to the doctor and getting from. All of those pieces are very important because they are barriers keeping people from receiving the health care that they need. So definitely learning compassion and empathy, and just the overall work. So that's what I would say.
I mean, a lot of times people have to make the choice between healthcare, and especially now, putting food on the table, putting gas in the tank, especially now, some who just put gas in the tank. And it's not just a copay now, right? You pay that $50, $60, $25 copay, and then next month you get a bill.
Yeah, absolutely.
And that's tough for folks.
Yeah, it is. It's very tough. A lot of the individuals that we work with is the underserved, individuals that are impoverished, so they don't have those funds. And when I was speaking about the gaps and as well as the barriers, those are some of the main things that kind of pull people away from going to the doctor and knowing that, okay, I don't have the money. And even if they do have the money, they choose to spend that money on other things, other necessities that they feel that they need right now, as far as the food goes, and what other habits that they have in between. So we're learning a lot in regards to some of the people that we've been working with. They've been on medication or off that medication for 3 to 5 years. And so you can just imagine how someone's mental health is impacted when they're not getting the medication that they need, or even just addressing some of their illness. So those are some of the things that we're continuously recognizing. And as Kendall was saying, like you don't never realize how privileged you are until you're sitting down in front of someone and it's like, hey, listen, I haven't had such and such in a long time. So it's like, okay, well, let's see how we can address that need. And that's kind of, the reason why we're here. We're working with nurse practitioners who actually care. And I want to give a shout out to elite nurse practitioner, Ms. April Bland. She's one of the our individuals that have been helping out and seeing individuals, meeting them where they're at. And so that's some of the things that we're looking to, kind of expand beyond. And that's one of the reasons why we're doing the Legacy Lab.
How do you, and we'll get to the Legacy Lab in just a moment, I promise.
Yes.
Because I'm so fascinated about what you guys do. It's you're talking about important services.
Absolutely.
Right. How do you get these healthcare professionals together, right? Because I look back to COVID, right? And they were at their breaking point. And it seems like every couple of years, healthcare professionals are at their breaking point. They're stretched thin. How do you say, all right, guys, let's take a deep breath, and we need to come together, and we need to help these folks in our community?
Passion. Passion fills all. You kind of have to search for the people who feel the same way that you feel about an organization or a cause. You reach out to the people through that shared common value, right? Helping the community, bettering our community. So you have to really look for people, and sometimes you don't have to look, because if you have that passion, if you have that fire, they'll come and they'll look for you.
So it doesn't. It's not even asking; they're showing up.
Yeah, and they recognize it.
Yeah.
We've have individuals that work with us or come to volunteer. They've been in the mental health field themselves, and they see the gaps that are there, and so they see the individuals that are, either they're homeless or they're going from one doctor to another, and it's like, okay, they can't find a home health place where they can be free. They recognize that, and so they're willing to chip in, they're willing to step up to the plate, and that's really what we target.
Legacy Lab, second annual. So y'all, you talk about a mountain of a climb, right? You start an organization, and then you have the Legacy Lab, a big event.
Yeah, it's a big event for us.
So organizations wait. Let's wait a couple of years, and then we'll get. But y'all got the ball rolling. For those who are interested, they're listening to this. What is the Legacy Lab?
The Legacy Lab is about movement. Movement is medicine, right? So we look at it as you have your other 5Ks and things of that nature, and so we work with a lot of individuals that are older, and so with our Legacy Lab, it's about movement. It's about getting out there, whether you're participating in the Zumba that we do, or you're getting out there and you're walking around the park. And so we don't discourage anyone. If they can't run, then they can walk.
Yeah.
And so we encourage that. Just come out, move around, and get outside. And of course, it gives us an opportunity to let people know the work that we're doing in the community. And so each donation, each dollar that is donated to us, it helps with free health screenings. It helps with those things of dressing like hygienes, because we're able to put together packs that will be able to, address some of those needs.
Yeah.
And then also when it comes down to testing, we work with a laboratory, which is a Rapha Laboratory, and other laboratories that are out there willing to provide those services. But we'll provide free screenings for those individuals as well. So it's about getting them the opportunity to continue to give us that opportunity to continue to work with them.
Kendall, I know you're running out there. He said walk. Jermaine said walk. So I know you're running out there. So
you don't have to. So you don't have to come. You don't have to run. We have different paths that people can take. So if you want to take the shorter route, you can take the shorter route. That's the route I'll be taking. So y'all can just follow behind me. You can follow behind me. We have a longer route. We have various activities. So we'll start with registration at 10 a.m.
Okay.
And then after registration at 10:30, we'll do our warm-ups. So get the body moving, get it ready. And then we'll do our little Legacy Lab. And take your time. Feel free to take your time. We have all day till 1 p.m. We have all day till 1 p.m. But yeah, and then after that, we might hit a few little line dances. So if you like the line dance, come on out, come on out. So it's really open to anybody, any and everybody, family, friends, the children, your grandparents, your aunts, your uncle. Bring everybody out so that we can celebrate, the ability to even be out there.
Yeah.
And celebrate, the life that we have. And, come have a good time with us. We're a good cause. So
Absolutely.
Yeah.
So they're not running, but they're hitting the Tamia dance because they said line dance. So
Yes, we will.
Now that's Tamia dance. Now I don't know. That's elevated.
here's the thing: it's still movement, right? It's
It
still
is
movement.
movement, whether you're right or wrong. We bumping into each other and everything. Yeah, that would be interesting.
Outside of the Tamia dance, right? What are y'all looking forward to the most? Even just speaking back to like last year, what is something that you're looking forward to?
I'm gonna be honest with you. We had some of the funniest people that came out there last year. They were out there in their wheelchairs. They were complaining about going the long route in their wheelchairs, and I'm talking about the motorized wheelchair. So that was much. It was kind of interesting, but yet and still everybody enjoyed it. Just seeing people come out, and we do it at Charlottetown. It's right there. It's one of the in-Livian properties that we work at, and so they come out. A lot of those individuals sit in their rooms for the whole year, and they don't come out. So we was able to pull some people out just to get outside, and then it gives them opportunity just to congregate, and just to be around other people and good energy. And so it's like, hey, let's come out. And to me, that was one of the best things, just seeing them smile and being outside. And then other people saying, hey, I didn't even know you lived here. So, as people were coming out and just joining with others, yeah, that was one of the best things that I was able to see. And I'm looking forward to that again this year.
What about you, Kendall?
Community. I love community. I love when people get together and they celebrate life and the things that, we tend to look at the things we don't have, but what about the things that we do have?
Yeah.
So just celebrating that, everybody getting together, influence is really big. Just having those conversations face to face, it gives us the opportunity to talk to any and everybody. Because you never know what service you may have or the services that people need, and just a conversation could change a life. So being able to give those resources, letting them know what we offer as Rapha Way, building that community, building that relationship, because that's extremely important too. And we want to extend that just further from the people that we work with, but to the entire Charlotte community. Even if you don't think you need the service, just a conversation. You may have an aunt or uncle who could use the same service. So just being in a space where we can be open and honest and just celebrate life.
And go ahead.
And we're looking for vendors. We're looking for vendors of healthcare and anything that's around that area. So we're looking for you all to come out, support, and come out and just give you an opportunity to advertise your business as well, and then also tap into the market of that community that we're serving.
One more time. I know registration opens at 10 and the walk starts at 11, but for folks, you got to repeat things.
Yes, absolutely.
Repeat when and where again?
It is this Saturday, June 6th. It starts at 10 a.m. and it's at Charlottetown Terrace, 1000 Pearl Parkway, Charlotte, North Carolina. So we're right there in the metropolitan area. So yeah, just come on out, and like I said, we're looking for vendors to come out and support.
Man, come out, show your support for the second annual Legacy Lab, the Rapha Way Foundation. Man, I did my research on it. Incredible work that y'all doing. I look forward to seeing you guys continue to grow this organization. And thank you for stopping by. So this is not going to be your last time here. This is just your first time.
Absolutely. We look forward to coming back.
Yes,
man, Jermaine, Kendall, Rapha Way Foundation. Thank you guys for stopping in studio.
Thank you.
All right, let's head to break. We'll be back here in just 2 minutes here on Live Impact News on the WCNC Charlotte.